women postpartum, because of all of these anatomical changes that they've gone through, are now predisposed to things like pelvic organ prolapse. So now, even with sneezing, coughing, laughing, or bearing down while they're having a bowel movement, they just don't have as great of support anymore. And so those pelvic organs can start to shift towards the vaginal wall and even start to make their way through or cause a prolapse. That can be so uncomfortable.
Welcome to the Wellbeing. I'm here, Rachel,
I'm Madison.
and and we're here today with Marissa, who is one of our favorite humans ever. She's also a physical therapist and she specializes in pelvic floor. So welcome, Marissa.
Thank you so much. I'm just so excited to be here and to be able to open a dialogue with the two of you who I very greatly admire. So thank you.
You're such
We
a
are,
lovely human,
Thank
a
you.
wonderful human being.
yes,
Thanks.
yes.
Thank you.
Thanks for being here. I feel like the beginning of these are
Mar
always just like a love fest.
Of
so
course, as
much.
they
Yes,
should be.
I love it.
yes, yes. I feel like we've talked about pelvic floor health like on a few different podcasts, like touched on it, and we've been like, oh, we have this coming up, like let's save it. So we are just super excited to have a super knowledgeable human on here to walk us through all the things we need to know.
Seriously.
Hmm. Hmm.
Can't wait. So introduce yourself, all the things about you, and then can you tell us what the pelvic floor is and why it
Yes.
matters?
Yes. Thanks, Maddie. So, my name is Marissa. I'm a pelvic floor physical therapist. Right now, I am working in a wonderful private practice. It's a women's health collective. I work with an incredible pelvic floor physical therapist named Justine. She's the founder of this clinic. It's called the Healing Spot. It's just absolutely wonderful and a lovely place to work and just grow as a pelvic floor physical therapist. I have been treating the pelvic floor as a PT now for 4 years. And I will say that at the beginning of my career, I was treating a mix between pelvic floor and general outpatient orthopedic conditions. And I was just noticing, as I got close with a lot of patients, that they would start confiding things in me like, hey, by the way, I leak urine when you make me do those burpees or when I jump. And, or, I would have patients tell me, like, I'm getting ready to have a baby and I'm just feeling overwhelmed. Like, I don't know how to prepare my body or things like that. And I just felt this pull to spend more time in this specialty. And so, from my training at Marquette University in the pelvic floor, my last semester of PT school, plus the plethora of continuing education courses that I've taken over the 4 years, I took the step into treating women's health and pelvic floor full time. And it's been so fulfilling and so rewarding in so many ways. So to answer your question, you asked what is the pelvic floor or like what is pelvic floor PT? Okay, great. So the pelvic floor is a group of muscles that line the bottom of the pelvic bowl. And these muscles integrate into our major pelvic organs. So for women and people with, female anatomy, that's our bladder, the walls of the vagina and the uterus, and then the rectum. And these muscles integrate into each of these organs to help with controlling and opening the sphincters. So that's what allows us to pee and poop normally. But it also is, this muscle group is what allows us to retain urine and stool or fecal matter. So we're not leaking all day long. Um, I think when we talk about the pelvic floor, so many people like to look at it as, an isolated muscle group working on its own, but this muscle is really important to the greater core. And when we talk about the core, I think a lot of people believe it's just my abdominal muscles, it's my six-pack abs, but it's our pelvic floor, it's our abdominal wall, our diaphragm, our back muscles, our hip muscles, all of these really important areas. And so outside of looking at the function of the pelvic floor, in an isolated fashion, like how it impacts the organs and how it supports these pelvic organs. Also looking at how it functions with all of these other muscle groups to, manage intra-abdominal pressure, to manage back pain, and a whole host of other things. So I hope that answered the question.
Yes, and
Okay.
more.
Okay, great.
So you mentioned like urine incontinence, and I'm assuming that's a huge thing that you treat. And I know one huge thing that, like, if somebody mentions pelvic floor, there's guaranteed one thing that someone will know is the word Kegel. So
Yeah.
can you talk a little bit about, like, are Kegels all inclusive? What is the what is the patient population that you treat? Like, who is this appropriate for? Is it only for people with incontinence issues, that type of thing?
Yeah, so let me start with like who is this for, and then I'll circle back and like tie in the Kegel question because that
Perfect.
that is I think like a general myth, and that like Kegels are just the only thing that we can do for the pelvic floor, or that's the best thing to do for the pelvic floor, and that's um, it's a part of it, but it's not the whole truth, right? It's like not the whole story. So anyway, um, okay, so I would argue that anyone and everyone with a pelvis who are experiencing pelvic dysfunction, right? So incontinence of urine or stool, and or gas, pelvic pain with sex and intimacy, um, difficulty emptying our bladder or our bowels, people who strain during bowel movements or struggle with constipation, um, pain with urination or bowel movements like burning, numbness, tingling, like all of those things, you would absolutely benefit from pelvic floor physical therapy. Um, a population that I think we need to spend some time talking about as well is women who are pre and postpartum. So the pelvic floor is so important for the stability of the pelvis and the low back. These muscles work to, support the opening of the vagina and the uterus, especially as somebody is, going through pregnancy. Those muscles have to be addressed and they have to be talked about. And when we're not helping these individuals in that way, like it can create a lot of distress or discomfort towards the end of pregnancy and during the birthing process as well. Um, so then, we kind of come to like, okay, well, what do we do for the pelvic floor to strengthen these muscles or address these muscles? And a lot of people, like you said, Rachel, go right to, the Kegel exercise. Like that'll do it, right? It must. But that's just not true, right? So, um, yes, Kegels have a place, and pelvic floor strengthening via that intervention has a place, but that's not the whole story. So, um, the pelvic floor, just like any muscle in the body, has to have an appropriate length tension relationship. So if, for example, an individual comes to me and they're telling me, I have urinary incontinence, or every time I sneeze, cough, laugh, I leak urine, like dribbles of urine, or sometimes the contents of the whole bladder. And what I'll do is an internal pelvic exam to assess the function of these muscles. And if I'm assessing those muscles and they feel like tight bands of tissue, or they're really restricted, or that patient is struggling to relax those muscles fully, a Kegel is not going to serve them to strengthen those muscles, right? That muscle is shortened. It has nowhere to go. So if we try to get them to do a Kegel and shorten and tighten this muscle to try to strengthen it, no good is really going to come of that. So for an individual like that, we have to work on down training, relaxation, soft tissue techniques to lengthen the tissue first, and then we can introduce the Kegel. So that's tightening and engaging and squeezing those muscles to lift and support the pelvic organs in a functional way. But yeah, if that muscle's too tight, if it's high tone, if it's not moving well, a Kegel is not going to benefit it
That makes a
in
lot
that
of
way.
sense. And I think a lot of people, at least in my world and maybe in yours too, you see this with neck pain a lot where people are kind of up here. And I'm like, okay,
Mm-hmm.
well, just like if you tried to strengthen this and your ears are like, your shoulders are like earrings, right? That's not going to benefit you. You're just going to start to feel worse and worse, and your muscle is going to get tighter and tighter. So if you have a hard time visualizing your pelvic floor and your pelvic bowl, right, that layer of muscles, you can Google them. But if it's
Yes.
easier to visualize like a shoulder shrug up towards your ears, if you tried to just make that stronger, you would probably feel worse. Whereas if you practice breathing and relax your shoulders and stretch and things like that, and maybe strengthen your deep cervical muscles, but that's a different story.
Yeah.
That would probably be more beneficial than trying to just put more strain on them.
Yeah, that's a perfect analogy, Maddie, and that's one that I will often show my patients because that's external, right? You can see that, like that change happening. And yeah, you make it a really good point. Like it's just difficult for people to put their mind's eye and their awareness on these muscles because they're deep, right? They're within the pelvis. They're not muscles that we can easily get to or see. So that can be really challenging for somebody to even like have the awareness that, oh my gosh, I'm holding these muscles in this tone or this like tight space. Like sometimes they just don't even have an awareness of that fully.
That makes a
Yeah.
lot of sense.
Hmm.
That's such a good point that it's like, if I'm understanding correctly, like it's one piece of the puzzle. Like when we go to PT school, we learn all these different modalities, right? Like we would never just assess somebody's strength and that's it and be like, okay,
Hmm.
let's do more strengthening. Like there's so
Hmm.
many different things, range of motion, flexibility, muscle tension, all those things that we assess. So
Hmm.
that makes a lot of sense where they might just not be appropriate slash probably fixing the problem for a lot of people that come in with issues.
Yeah, totally. And I think another layer to this is addressing the bony anatomy, right? So if we imagine like each half of the pelvis is like part of the bowl and the sacrum's back here, right? And the pelvic floor is kind of scooping or lining the bottom of this bowl. Well, if I wish I had my pelvic model, this would be so cool. But if one half of the pelvis is rotated forward and maybe the other is more back, or one is shifted up versus the other one is kind of experiencing like a downslip or a shift that way. Well, imagine what's happening to those muscles on the bottom of the bowl. Like they're just at the mercy of the bony alignment. And so if we're telling someone like, oh, you're leaking urine or you're leaking gas or stool, like you should just do Kegels to improve that. It's like, well, if their bony alignment is not in a great place, which I see with a lot of postpartum moms, um, that muscle is just being tensioned in a way that it can't now engage optimally. It can't shorten to support the pelvic organs or support the pelvis. So again, that's just circling back. Kegels are not the only thing. There's so many other things we need to address first before we start talking about how to engage and strengthen and find these muscles to really manage somebody's symptoms in a well-rounded fashion. So,
That
Hmm.
makes a ton of sense. I'm curious if you find this in your practice. I know that a lot of people will say, well, that's just for postpartum moms or right after you have a baby. And I'm curious if what your response to that is, because I have gotten that response from people who may have had children in their past and have gone to PT or didn't go and they're still leaking urine but didn't know this was an option then. And they're like, oh, well, that's just for postpartum moms. What do you say to that?
yeah, that is not true. And I can understand why people think that, but it's just not true. Um, I mean, we have a pelvis and we have pelvic floor muscles the entirety of our lifespan. So, um, we should be working on that and being mindful of this area, knowing that you can receive pelvic floor physical therapy and receive treatment to this area at any time. It doesn't have to be tied to a certain life event like pregnancy and postpartum. Um, so yeah, I think too, like a lot of symptoms around pelvic health. So like we keep talking about urinary incontinence, that's just very common. That's an easier one to discuss. So I think things like incontinence, for example, a lot of people have just been told, okay, well, as I age, whether or not I've had children, as I age, this is just a normal part of aging to leak urine or leak gas or leak stool, or to struggle with the opposite problem, not being able to empty urine, stool, gas, etc. Um, But I think we need to rework how we talk about these symptoms and how we talk about symptoms around the pelvis and the pelvic floor. Like, yes, it may be very common that as people age, they start to experience more leaking or issues with retention, but um, that doesn't mean that it's normal. Because I think when we assign something like that as normal, people don't seek help and they stop talking about it too. And that can really disadvantage a, a large part of our population who deserves good care and deserves to be taken good care of and given strategies and treatment so they can improve their quality of life. I mean, let's kind of talking about like the elderly population, and I know I'm going all over the place, so like bless you too for staying with me. But as if we look at the older generation, right? There's already concerns about mobility and being able to get out into your community and engage with community members, so friends, family, etc. And so if you add to that layer, okay, well, now I'm leaking urine and there's an odor, or it's embarrassing, or I don't have the dexterity to effectively take care of myself when I'm out in public like that, well, that population now starts to isolate even more. And that can have a horrible impact on their quality of life. And so, no, I don't think that pelvic floor physical therapy is just for people after they have a baby. It's for anyone across the lifespan, and it needs to be considered across the lifespan to manage these symptoms that are not normal. Just because they're common, they're not normal. So it can improve somebody's confidence, their quality of life, and just keep them much happier and healthier.
I love this so much. And Maddie and I had a similar conversation about balance and like balance related falls. And
Yes,
we were
yes.
talking about bone mineral density, osteoporosis, all of those things, and especially like with
Hmm.
menopause. And we were just talking about balance in general. And obviously, Maddie's a balance specialist, especially in the vestibular vertigo, dizziness, all those things.
Yes.
Um, and me for babies, I can do all the balance
Yeah.
things.
Yeah.
But we were just talking about like that doesn't have to be normal. Like as you age, same as what you were saying, you don't have to be at an increased fall risk. Like that doesn't have to be a normal process of aging. And that I just love that. It just fits into so many different parts of PT. And I like it's moments like these where I'm like, PT, physical therapy is just such a cool field. We
Yeah.
learn so much. Like even though sometimes maybe I'm sure I feel like all three of us have felt this where we're kind of like, what are we doing in our career right now? And we've all pivoted, right?
Mhm.
But no matter what, I do feel like the education that we gained was so much about
Mhm.
how to live our lives with wellness and holistically and
Mhm.
basically be able to live our lives from 25 after we graduated about all the way up to however old we get with an amazing quality and knowing how to
Mhm.
seek out those things. And so I'm going off on a tangent now, but I just love and will always appreciate that so much about this field.
Yeah, I
Hmm.
agree. If you are listening to this or you know someone who is thinking about going to PT school, it's definitely something that you have to love and like really want to be. But I do agree, like the education alone at most schools, definitely not all schools, but at most schools is phenomenal. And knowing so much about your body, like we do talk about pharmacology and nutrition and exercise and corrective exercise and pain and dizziness. We talk about so many things. And I feel like not all medical professionals get that because either they're having to learn so much information, they barely graze the surface of it, or they are so specialized that they don't. And I just think that physical therapy, plus we get to be autonomous, which is my favorite thing about it.
Hmm.
Um,
Yes.
yes, there's a lot of benefits to being a PT, but
Mm-hmm.
I think it's cool we can all sit here, be I could not do either of your jobs anymore, but we all have the exact same degree, which I think is cool.
Hmm.
Hmm.
I could not do either of your jobs,
Yeah,
I'll
definitely not.
say
I
No,
right
was
we
gonna
could
now.
say,
not. There's
wait
no
a second.
floppening. No,
No, no,
no,
no,
no.
No,
no,
no.
no, 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 no.
I
And
actually
go ahead, Maddie.
no, I have a pelvic floor certificate. Fun fact. I am pelvic floor educated,
Cool.
and I never used it and I couldn't tell you how to do it. So even if you were certified, it does not mean, it kind of goes back to like knowing your provider. Just because you're certified in something doesn't mean you use it. I can wave that certificate around all day long, but if you came into my office right now, I'd be, oh no, couldn't tell you.
And that's
That's
okay, because
okay.
I
Yeah.
think, just being like honest as a provider too. I
Yeah.
mean, and finding people that can mentor you and that you
Yeah.
can lean on. Like if that is something for you that you're like, okay, maybe I want to get back into that space. There's a
Yeah.
population, there's a need.
Mm-hmm.
Like finding a good mentor, oh my word,
Mm-hmm.
like that'll change your life, you know?
Mm-hmm.
So
Totally
I
agree.
feel very, very fortunate that I've had some really incredible mentors along the way that have gotten me
Awesome.
to this point and are like continuing to like foster my growth in this field and like support me in it and like are seeing the enthusiasm that I have and they're like, yeah, let's like fan this fire. Like, come on, let's get it
Yeah,
going, you know? So
absolutely.
it's cool as I'm sure like the two of you have probably experienced something
Yeah,
similar too. It's so important. It's
it
important to
is
have
important.
mentorship and community. So
Hmm. Yeah,
And
it
I
is.
think that leads nicely into this question of like, is it necessary for someone to see a
mm,
specialist? Or can you just go to any old PT and be like, I am leaking urine. Should I see you?
Yep.
mm, yeah, I think it's important.
Please don't.
No, I think it's important that you see a specialist, so a pelvic floor physical therapist, if you are experiencing pelvic dysfunction, because pelvic floor physical therapists spend so much time learning the ins and outs of this area, and they just, but they're also taught like how to approach these symptoms and approach these conditions with um, kindness, creating like a judgment-free space, creating like a healing space for people to just come and share these things. I mean, these symptoms, like I feel very comfortable being like, I'm going to talk about pee, poop, and sex. Like that doesn't bother me, right? But for the general population who for a very long time, I think we've been taught like this is our private area, these are your private parts. You don't tell anybody about them. You surely don't show anyone, including a healthcare provider, them unless you absolutely have to. It's embarrassing if you have any of these symptoms, like you should be exiled to go figure it out yourself, you know? And so I think as pelvic floor PTs, we're taught how to create a healing space and a judgment free space and a space of kindness where people can come and just share these symptoms and know that it's okay and they're safe and that we can help them and they're going to get better. And that, I mean, I've had patients who like come in and as they start explaining their symptoms to me, they just start crying because nobody's listened to them, even a urologist, an OBGYN, and there's nothing wrong with those professions and these providers are incredible, but sometimes they're just made to feel like their symptoms are so off the wall or they're embarrassing or that they're uncomfortable to talk about. And they come into the healing spot where I work and they'll start to share their symptoms with me and they just start crying because it's really emotional. It's had such an impact on their quality of life and they feel like they've had to hold it inside and deal with it themselves for so long. And now there's finally somebody sitting in front of them who's like, bring it on. Like, put it all on the table. And I'm not going to judge you or make you feel ashamed. Like, I'm here to help you. I need to know these things. So, I'm very chatty. So I think, yes, seeing a specialist is very important. And then from an anatomical standpoint, pelvic floor physical therapists, like I said, spend so much time really understanding the ins and outs of the pelvic girdle, the pelvic floor, the pelvic organs, and how to have an impact on them through soft tissue mobilization, exercise and strengthening techniques, how to include, abdominal strengthening, diaphragm engagement, um, low back strengthening, hip strengthening. But then they also are given training on how to look at somebody's bladder habits. So, how often are you peeing? What type of urge are you getting? Is it too strong? Is it not strong enough? what type of fluids are you drinking? Understanding what type of fluids irritate the bladder and can cause leaking. And then same thing for the bowels. Like we're taught in depth um, about the function from the moment like food or fluid touches our lips to how it gets all the way to the bladder and the GI and then eventually the rectum. And we're taught, what are the common bowel irritants? How can we help somebody work through when to start eating fiber versus backing off? How to incorporate a pre or probiotic? Toileting habits. Like we learn all of those things. And then I haven't even touched on like sexual health and wellness, but we learn all of those things so we can confidently be there for our patients and navigate them through this almost like uncharted territory for so many people because they're just not taught about their pelvic anatomy or understand like the ins and outs of that. So, we're taught how to help somebody through that and navigate them through those symptoms in a way that's easy to understand and easy to incorporate into their day-to-day life so it doesn't feel so overwhelming and stressful anymore. Because if you're peeing your pants or pooping your pants, it's stressful. That is so
Oh my
stressful.
gosh. Yeah. Yeah.
So,
I love that you brought that up so much because one of our huge reasons of even starting the podcast is to help people learn how to become an advocate for their own health. Just
mhm.
because I know in my field, I've seen babies and kids, like normally for me, it's siblings because I was in the home and I like noticed something like, hey, I really think that they could use a PT referral that either was missed by their pediatrician or was warranted unnecessary by their pediatrician. Even like, I mean, I've had a kid that their head shape was completely abnormal and they had torticollis. And I was like, hey, ask for a PT referral. And they said their pediatrician was like, no, he doesn't need one. And I was like, ask again. And she did give one. But I know, Maddie, you see this all the time in your field too, where people have cycled through the healthcare system and they've tried thing after thing after thing after thing. And I know Joe, who's also a PT, my husband in the concussion world, same thing, like has people have cycled through the healthcare system and they have gotten to a point where they're like, I don't believe that there's anyone out there to help me. And maybe I'm just going to have to live with this or try some crazy, crazy healing technique, like insane stuff. But if you get that desperate, that's kind of what happens. So I love that you brought that up because I think moral of the story, no matter what's going on with you, whether it's pelvic floor, whether it's dizziness, if you're a mom, I see this a lot. Moms have intuition. Like if they know when something is wrong, seek a second
Mm-hmm.
opinion. Do some of your own research. Like go to see a different doctor. Look up. I mean, obviously Instagram is like a not necessarily a reputable source, but look up for with someone that maybe has a degree, like a PT. Like there is so many options out there. So I just love that you brought that up. Um, I don't know if you have anything else you wanted to say on that, Maddie. I do have another question, but if you have
Yeah, I
anything you
just
want to
think
say
we
about
need to
that.
have you back to talk about sexual wellness because it's so important, but I don't think we have time to like talk about all of it today,
Ugh.
but
No,
it's
no,
so
no.
important and everyone doesn't want to talk about sex, but it's like everyone's doing it.
Yes,
Like,
yes. That's what I'm saying. Like, we cannot keep
yeah,
pretending like people don't pee, poop, and have sex and like,
correct.
keep those conversations out of a primary
Yeah.
care office. Like, that is not doing anyone any justice.
No.
And yes, I would happily come back and talk about all
Okay,
that
great.
because,
We'll do it next time.
Okay,
But
that
okay,
all
is
about sexual
great.
health.
that
Yes.
is the
Thank
name
you.
of the podcast. Pee, poop, and having sex.
Yes.
Yes.
Everybody poops. There's a book about it, and then we stop talking about it after we're like six.
Yeah.
What is with
Yeah.
that? Yeah.
Yeah.
I
I
talk
don't
about
know.
poop a lot, actually,
Good.
It's
as a
an
human
important.
being. It's
Yeah.
important.
Yes. Obviously, we have to do it. But
Yes, we
okay,
must. Yes,
I
question.
want to get this question in because I have a lot of questions about this, and I feel very passionate about this with having, I think I've had like 4 or 5 friends lately that have had babies, and
Yes.
I've told every single one of them I've tried to
Of course.
tell slash advocate for pelvic floor health and maybe going to a PT. But I would love for you to talk about that a little bit. Why, how to, I know out of all of my friends that are pregnant right now or recently had a baby, only one of them went to see a pelvic floor PT before and after because she is in healthcare and her friend did it and she asked for a referral and
Mm.
they were kind of like, okay, that's fine. So I just want to know your stance on that. If you think that women should have to advocate that for that and ask the question for that, or if it's only really warranted in certain cases.
I think it's very important that women prepartum, during pregnancy, and postpartum are at least evaluated by a pelvic floor physical therapist who has training working with women kind of through their arc of pregnancy and then postpartum. Um, I believe, hot take, that all women after they give birth should have a referral to a pelvic floor physical therapist. Like, I obviously giving birth and surgery are not the same thing, but when you have a major surgery, like let's say you have, an Achilles tendon repair surgery. Obviously, birth and that type of surgery are not the same thing. I want to make that very clear. But you go and you see a physical therapist immediately after. Like your surgeon, like as you're waking up from general anesthesia, is writing that referral, and you're seeing them ASAP to start rehabbing. I think we need to take the same approach with women postpartum. Their bodies have gone through this very large change in a short amount of time to bring a life into the world. And that's incredible. And that's a miracle. And that's wonderful. And obviously, like their lives are shifting to now care for this small baby. And that's wonderful. But I think that doctors need to advocate for women and give them a referral to pelvic floor physical therapy after they have a baby. I don't feel like that should be something that women have to go into their OBGYN or their primary care and have to ask for. I feel like it should be like on the docket, waiting, hit send for that referral.
I
That's
think it
so important.
I think it
Go
should
ahead,
be
Maddie.
in Epic or whatever like EMR system your hospital uses, so you don't even have to write it. Like it should just come with it, like
Mm-hmm.
an ACL repair.
Mm-hmm.
One of my best friends from college is in residency right now to be an OBGYN. And
Mm-hmm.
as a PT, when she went to school and she was going to be an ED doctor, and then she decided the hours for OBGYN were better, but also the stuff was just as cool to do. And so she's like, I'm going to
Yes.
be an OB. She loves it and
Mm-hmm.
she's great at it. She goes, I told her, I was like, as you're one of your very best friends on this planet and a physical therapist, you are required to write every single woman who delivers on your schedule a prescription for pelvic floor physical therapy. And she does. And I was like, I love
Great.
that. It makes me so happy. She lives down in Denver. She rocks. I know. She goes, every other attending looks at me like I have 18 heads.
Ah,
And
it's
I'm like,
frustrating.
are you joking? She goes, I do it anyway. I don't care. I'm like, I'm so proud of you. Stick it to the
Yes,
man. Like,
yes,
isn't that crazy?
yes. And
It's so
that,
frustrating.
it is frustrating
Hmm.
because and I feel very fortunate that the clinic that I work in has really good relationships with birthing centers in the areas. We have midwives and doulas that refer to the healing spot. And so these moms are usually very aware of like, okay, I need to get in and start this process. I need to start with a pelvic floor physical therapist. Like they have that awareness. And because we're a private practice, we don't go through insurance. We don't need a referral. Like, just makes that process a lot easier. Again, I feel very fortunate. Um, but in general, that referral, I'm so passionate about this. That referral needs to be there because a lot of women who kind of go through the standing birthing process where they go to a hospital and
Hmm.
things like that, that education just isn't
Hmm.
there to teach
Totally.
them about like how important it is to pursue that after. So, um, if it's okay, I'm going to go into like kind of like the anatomy
Hmm.
changes that go
Yeah,
on with pregnancy
please.
and then during birth, and
Yeah.
then where pelvic floor PT kind of fits into that. So,
Yeah.
um, so during pregnancy, right? That obviously with baby growing in mom's belly, and it's a really wonderful thing. There's just a lot of changes that are happening, right? So as the baby gets bigger, that weight starts to shift forward from the belly, just like our center of mass starts to change. That increases, we've all seen like kind of like the pregnancy posture, right? So like increased lumbar lordosis or increased curvature of that lower part of the spine. The hips start to kind of rotate or tilt forward. And then obviously we're getting a stretch through the abdominal muscles across the front of the stomach. The pelvic floor muscles are working hard to support the pelvis through those changes and to support the low back, especially now that the abdominal muscles are being put on stretch. And like we talked about before, that length tension relationship is so important for muscles to be strong. So as those abdominal muscles are stretching across the belly, their ability to be strong and support the spine starts to diminish a little bit. Now, that doesn't mean that women are unstable, but there's just muscular changes that are happening. We have to be aware of that. As the belly continues to grow, as baby continues to grow, that's putting pressure through the diaphragm. So now the diaphragm can't descend quite as much as mom is breathing. And our body is an incredible thing, and it finds ways to compensate for all of these changes, before baby comes into the world. So now, as we're getting closer to when baby arrives, right? Birth. And so during the birthing process, as the baby starts to descend towards the birthing canal or towards the opening of the pelvis, our bony anatomy or the bony anatomy starts to shift, right? So if we think of that pelvic bowl and the sacrum's back here, and this is the bottom of the bowl, the bony alignment starts to shift. So it starts to go upward and then slightly outward, and then the sacrum starts to tilt, right? So that's pulling the tailbone out of the way. It's opening up the birthing canal so baby can come into the world. We have muscles, our pelvic floor, that line, the bottom of that pelvic bowl, those muscles have to have appropriate flexibility to allow that shift of the bony anatomy to happen, and then to allow baby to exit the vaginal canal and come into this world, a vaginal birth. Once baby is here, it's lovely, it's amazing, it's incredible, you're a mom, but now your body is trying to recover from all of these changes that have been going on for the past 9 months. So your diaphragm is, kind of squished up under your ribs still, your abdominal muscles are stretched and they don't have great tone or coordination. Your bony alignment, for a lot of moms, their bony alignment, ideally, as it's gone through this big shift to open the birthing canal, the bones don't always settle back into that original alignment, right? So sometimes one hip can stay slightly up or forward, or the sacrum can kind of shear. And so if that bony alignment isn't addressed, well, now we've got a group of pelvic floor muscles that have gone through an incredible stretch to bring your baby into the world, and now they're being put on tension with some changes in the bony alignment. How the heck are you going to engage these muscles functionally, right? Like, these are the people who are like, okay, just do Kegels. Like, while baby's napping, just do Kegels. Like, no. They need more than that. They need more attention than that. And then, the changes to the lumbar spine, right? That kind of increase in the lordosis, like we have to work to minimize that to effectively change how load is being put through the spine. If we're looking at this just kind of zoomed out as well, like we've got changes to the spine, changes to the pelvis, changes to the abdominal wall and the pelvic floor. Your ability to manage pressure has now changed significantly. All of your typical, is what I'm looking for, all of your typical strategies for managing pressure, so good tone in your abdomen, pelvic floor, and diaphragm, has now changed, right? So women postpartum, because of all of these anatomical changes that they've gone through, are now predisposed to things like pelvic organ prolapse. So now, even with sneezing, coughing, laughing, or bearing down while they're having a bowel movement, they just don't have as great of support anymore. And so those pelvic organs can start to shift towards the vaginal wall and even start to make their way through or cause a prolapse. That can be so uncomfortable and cause issues with being able to empty your bladder or your bowels. Like, that was such a rant. So thank you for following along. But it just goes to show, like, it's really important that these women come in after they have a baby. There's so many things that can be addressed. And if we address them early enough, it prevents long-term dysfunction, pain, prolapse, incontinence, all sorts of stuff like that.
I love that answer, honestly. Thank you for walking us through the whole thing.
Yes.
It's actually really important to understand,
Mhm.
um, because having a baby, I think, is kind of traumatic on your body. Not that it shouldn't happen or it's not a wonderful thing, but your body also needs to recover. And in every other culture, except for I think in the United States, women are encouraged to rest and not do a lot and care for the
Mhm.
baby, but stay in bed or stay near the bed or and stay closer to home. But in the States, you're like, all right, you get 2 days off and back in your desk chair. It's like, no, we need
Yes.
to not do that and take
Yes.
care of our bodies. And it is so, so important. And we have time for one more question. And I
Sure.
have this one because I'm really curious about this, which is
Sure.
about products that you need to use. Because I know a
Yeah.
lot of people are just buying the Charmin toilet paper at the store because that's the one you've always purchased and it's soft and all of the things. But I would love to talk to us through like different products in general, period products, toilet paper,
Underwear.
pelvic underwear, all the things, products.
Yeah. All the things. Yes, happy to. So, especially for like women's health, right? Like this is more like my realm and what I end up talking about. I can't say the same or that I know the same to be true for men's health, but I would assume it would be. But from a, from a women's health perspective, right? So we're talking about like vaginal anatomy. Um, the the vagina is so it's sensitive, but it's also like very resilient, right? Because it has its own microbiome, it has its own way of like regulating in terms of like how like I don't want to say clean, but in terms of like regulating its microbiome to keep it clean and healthy and happy and all those things. The vaginal like mucosal linings are sensitive, okay? Like this tissue has an opportunity to absorb different chemicals is so dramatic, but different chemicals that it's exposed to. So when we're thinking about products, it's really important to take into consideration like what is touching your vaginal tissue day after day after day, wipe after wipe, or with underwear and things like that. So in terms of toilet paper, right, I am still on this journey of trying to find an unbleached toilet paper. I've looked on Amazon and there's like bamboo-based toilet paper. I don't know how effective that is, but the idea is that I encourage people to come away from bleached products. So like bleached white toilet paper, like bleached white tampons, right? Things like that that just have been exposed to all these chemicals so it can be this like pearly white color for what reason, I don't know. And so things like bamboo toilet paper or even reusable toilet paper, as you know, as icky as that may seem at first, there are brands that create this reusable toilet paper where it's almost like cloth and you can use that to clean yourself and then you just throw it in the laundry or throw it in the wash. Like for our eco-friendly friends, like that's a lot of water. So if you're not comfortable with that, I understand. But like trying to get away from these like bleached products, toilet paper, tampons, things like that, and instead using reusable toilet paper. Silicone menstrual cups are great in terms of a product for menstruation. They're far more comfortable, and based on the like technology and how they're designed to be inserted into the vagina and removed, it reduces the pressure, the negative pressure in the vaginal opening. So when you imagine like inserting and taking out a tampon, there's quite a bit of pressure as you're taking a tampon out, and that can create some not so great pressures within the vaginal wall. Not that it predisposes you to prolapse, but it's just not great for the vaginal wall. In terms of underwear, right? And I would say like athleisure wear as well, like trying to avoid wearing clothing that has a lot of polyester in it. So that like super tight, like really ultra stretchy stuff that just like hugs into your every nook and cranny. that's just not great for our vaginal tissue to be exposed, our vaginal mucosal linings to be exposed to chemicals like that for however long we're wearing our underwear, right? So looking for cotton underwear, underwear and athleisure that's more loose fitting versus all this like skin tight stuff, can be just really beneficial overall. I mean, that can minimize your risk of developing things like UTIs, yeast infections, all sorts of stuff like that.
Yeah. I love that you said that because it is such an absorbent area. Like it sweats,
Hmm.
it gets wet. There's a lot of things that happen down there. And I just think
Yeah.
that it's important to understand that if you are putting, I don't know, you didn't mention this, but one that I see like scented toilet paper near your um vagina, near your urinary tract, in your rectum, wherever, that is phthalate. Am I saying this
Hmm.
word wrong? Phthalates. It's forever chemicals. They are endocrine
Yes.
disruptors. And the place you least want to put an endocrine disruptor is anywhere on you, but especially near your vagina and near
Hmm.
just your whole pelvic organ system.
Hmm.
Because it is really absorbent and it can cause a lot of problems. I have
Hmm.
switched to bamboo toilet paper. It's fine.
Hmm.
I wish it was unbleached. Why
They
can't it
do
Oh,
be
have some.
brown?
They do have some that's unbleached.
Oh,
We can
do they?
maybe link this. Yeah,
Okay.
yeah.
Did you find
I
it?
can link it. Yeah. Um, One other thing that, okay, so I've had the wondrous experience of staying at Marissa's beautiful apartment. And one thing that I noticed that you guys have that I know you talked to me about this before is a squatty potty.
I have
yes.
one of those. I love it.
Yes. So that is something, yes,
It's the best. Can't live
that's,
without it.
Yes, I'm
yes.
so glad that you said that because I know we only have like very little time left, but just talking about things that you should incorporate. Like before I was like, get rid of this and this and this. That can be really stressful for people. So things that you can add that can, add value to your pelvic health and just make you feel better overall is the squatty potty. Now I don't get any payback by promoting Squatty Potty, and I would stand at the top of our apartment complex and shout this from my balcony if I could. Like the Squatty Potty is incredible. Or really any stool that you can put in your bathroom next to your toilet that you can put your feet up on while you're sitting on the toilet is so important. It brings your knees above your hips and that changes the alignment of your pelvis. That relaxes your pelvic floor, which makes having bowel movements so much easier, right? We should not be like straining and holding our breath and like veins popping out of our face when we have a bowel movement. It should be we're sitting on our toilet with our squatty potty, knees above hips. We're relaxed. We could take a big breath in through our nose and we exhale gently through our mouth, and stool should exit the rectum. That's what should be happening. But
Love it.
yeah, that's just like not what's
Often
happening.
not what happens.
Not what happens,
Yeah.
right?
I saw on
So,
Instagram once, if you don't have a stool, you don't have a squatty potty, if you're traveling, I do this when I'm traveling. Maybe this is
mm.
TMI. Too late. I will put 2 rolls of extra toilet paper. There's always extra toilet paper in the hotel under my
Ah.
Yep.
feet.
Mm.
Works like
Hmm.
it only works if the toilet is relatively low, but you can also like double them. There's ways to get around it. I know they make foldable ones. I don't have one of those, but I do love squatty potty. Big
Yes,
fan.
that or even like the garbage can.
Yes,
Like
Mm.
put that on
Mhm.
its
I've done that.
side,
I've done
put your
that.
feet up on that. Like
Mhm.
incredible.
So good.
Incredible. But yeah, I think otherwise just like in general, just like general tips and tricks for just
Mhm.
keeping like a healthy pelvic floor. Um, like drinking plenty of water, staying hydrated, avoiding things that irritate the bowel and the bladder, like excessive caffeine, alcohol, processed foods,
Mhm.
um, really like highly sugary processed foods, things like that. Um, for the bladder, making sure that you're not straining or pushing to empty your bladder. You should sit, relax, just let the urine come out. Avoid peeing just in case. We've
Mhm.
all done that. Like, okay, I'm gonna
Yeah.
go on a long road trip. I'm just gonna go just in case. I don't really feel the urge, but I'm gonna go. Don't do that. That confuses the heck out
Mhm.
of your nervous system. That makes it really difficult for your bladder and your brain to talk to
Mhm.
each other effectively, and then for your pelvic floor to figure out what the heck it's supposed to do. Is it supposed to contract and support
Yeah.
and prevent urine from coming out? Is it supposed to relax and let you pee? It doesn't know. So just
Mhm.
avoid the just in case peeing.
Fair enough.
With go ahead.
No, we have one more really quick question.
Sorry, Marissa,
Yes, go.
I have
And then
a
I have to go.
question, and then we'll have to unfortunately
Yes,
end,
yes,
but
I know.
It's
I know,
my
I know.
wedding anniversary, so I have to go to dinner.
Congratulations.
Thank
Yes,
you.
Maddie. What are you doing?
I know.
Sitting here talking to me
Answer your
about
question.
peeing and pooping. That's
Ask your
terrible.
question.
Okay, super fast question. How do you feel about bidets?
Oh, yes. Amazing. Incredible. Big fan.
Thumbs up to bidets.
Yes, big
Okay,
fan.
I'm writing
Big
that
fan.
down.
Tell us where to
Yes.
find you, and then we're gonna have you come back to talk about sexual health. Thank you so much.
Sure. Yes, of course, of course. So, I don't have a professional Instagram,
Love
but
it.
you can look at my, general Instagram. It's Riss_Baumhart. Otherwise, yeah, shoot me like an instant message or like a DM on Instagram because I love to talk about this stuff, and then I can connect people even to like the Healing Spot or my Healing Spot email too.
Awesome. Thanks so much. We'll put it below. Thank you
Yes,
so much for being here. I can't wait to have you
of
back. You are
course.
so wonderful.
So are you. Thanks for letting me just
Yeah.
jabber on.
Rachel, what's your one thing? Rachel, what's your one thing you learned today? Fast.
My favorite thing, and everyone needs to do this, is if you are planning to have a baby or you've had a baby, please ask your doctor for a pelvic floor referral
Yes.
immediately.
Love
That's
it.
my number one thing.
You have the best one.
I
So
know. I went
second
first.
best one is to get a squatty potty.
Yes.
Do it.
Yes.
Yeah.
I love it.
Thanks so much, everyone, for listening. See you
Yes.
later.
Thank you.
Bye.